Welcome to the musculoskeletal physical examination for the hand and wrist. In this video, we'll demonstrate how to effectively and safely assess the hand and wrist for signs of musculoskeletal diseases or injuries, with particular focus on the clinical signs of osteoarthritis. The learning objectives for this video are to demonstrate how to fully assess the hand and wrist using the look, feel, move, and measure method, to show the most relevant anatomic landmarks of the hand and wrist, and lastly, to develop a consistent pattern for examining the hand and wrist. It is the assumption that a detailed medical history has been taken with the patient. Before starting the examination, wash your hands, introduce yourself and explain the examination procedure. Ask if they have any questions about the assessment, and if they do, explain thoroughly. If they do not have questions, ask if the patient is happy for you to start the physical examination of the hand and wrist. When you're ready to start, ask the patient to sit or lie down comfortably and ensure that you have adequate exposure to the area being assessed. We'll begin with the look phase of the assessment. Start by inspecting for alignment. Check the alignment of the wrist, specifically the carpal, metacarpal or CMC joint, and the alignment of the metacarpal phalangeal MCP joint, the proximal interphalangeal, the PIP, and distal interphalangeal or DIP joints. Examine for wrist and hand deformity. Compare each hand bilaterally. Look for any muscle atrophy on the dorsum and palm of the hand. Check for erythema and scars. Inspect the skin and the nails. Check for swelling on the wrist and dorsum and palm of the hand. Look at the flexor tendons. Moving on to the feel phase, we'll perform palpation of the hand and wrist. Assess for abnormality to skin temperature, for example, heat or coldness to the tissues of the hand and wrist. Palpate generally for swelling and nodules of the hand and wrist. Then move on to palpate for pain, tenderness, or localized swelling, more for each joint. Palpate the wrist, also known as the radiocarpal joint, and also the first CMC joint. Palpate the metacarpal phalangeal MCP joints. Palpate the proximal interphalangeal and the PIP and the distal interphalangeal or DIP joints. Then feel the flexor tendons and extensor tendons, palpating for any nodules, contracture, tenderness, pain or swelling. After palpating the hands and wrists for tenderness, swelling and temperature, we will move on to performing movement tests. The patient remains in a comfortable position while the assessor asks that they perform an active range of movements of the hands and wrists. The assessor demonstrates active range of motion in flexion and extension, pronation, supination, and abduction and adduction of the wrist, and asks the patient to perform the movement. If active range of motion is limited or the patient has difficulty following the instruction, then the assessor then performs passive range of motion examination of the wrist in flexion, extension, pronation and supination, and also abduction and adduction. After assessing the movements of the wrist and hand joints, we will check the integrity of the structures around the wrist and hand. We will start by assessing for function. We can assess hand function by assessing the patient's ability to perform tasks like opening a jar, using a key, buttoning clothes, writing, pinch grip, and power grip. To assess for compression of the medial nerve at the wrist through the carpal tunnel, we'll now assess for T-nail sign. The assessor lightly taps over the carpal with the index or middle finger. Use gentle yet firm tapping pressure. Ask the patient if they feel any tingling, numbness, or an electric shock sensation or percussion. A positive test is reproduction of these symptoms. To assess osteoarthritis at the base of the thumb, we'll now test for compression or stress in the first carpal metacarpal joint. The assessor grips the patient's first metacarpal and moves it in a circle while still loading the joint. Ask the patient if they feel a sudden sharp pain at the base of the thumb. A positive test is reproduction of these symptoms. Ask the patient to extend the hand in front of them with the palm face down. Ask the patient to close their fingers into a fist with the thumb positioned inside the closed fingers. With the patient's hand in a fist and the thumb tucked inside, instruct them to bend the wrist towards their little finger. As the patient bends the wrist, you can assist by gently grasping the fist to help maintain the thumb's position inside the closed fingers. Ask the patient to hold this position for a few seconds, paying attention to any signs of pain or discomfort in the wrist and thumb area. Lastly, we assess the muscle tone and strength or atrophy of the opponent's pollicis, the flexor pollicis brevis, and the abductor pollicis brevis. With your thumbs. Again. Okay. And then, and try to touch your pinky with your thumbs. Wonderful. Thank you.
Thank you.
Thank you, Sophia. That completes the examination. Now we can talk about the findings and how to improve your symptoms.
Thank you very much.